Now, it's very important that when a speaker stands up here lecturing to you, it's very bright, that you just don't believe everything that I say. Okay? No, really, truly. It's very important. So in cancer, the patients that do well are the ones that actually quiz the doctor and go and look at the research. And it's very important for you to kind of do your own research. At the end, I've got 3 lectures here over the next couple of days. At the end of the 3rd lecture, I've given all my references, and I presume the people that are here are going to be here for the whole 3 days. So look at the references at the end. Probably the most important one is by life extension. So if you go to life extension health protocols, that's the most important reference. The second thing about cancer is it's a very individual disease. So the things that I'm going to say might sound kind of a bit odd in reference to what the other people before me have said. But what I'm talking about is specifically about cancer. The treatment is very important that you individualize your treatment. What works for one lung cancer may not work for another lung cancer. So your treatment has to be very specific and very individualized. I'm hoping that when you leave here, like today after 40 minutes or 45 minutes, that you're going to leave here with at least 5 clinical things that you can use in your clinic next week. Okay, so we can simplify cancer as a balance between oncogenes, the ones that kind of cause cancer, and the tumor suppressor genes. And I'm going to go through a little bit of biochemistry, but not too much. The main thing to realize is that genes are not fixed. Above the gene is the epigene, and we know we can alter how the epigene influences the gene, and therefore how gene expression occurs. So we can actually alter gene expression quite significantly. And those are some of the ways that genes are expressed. Okay, the DNA methylation, histone modification, it's probably not so important. But there's lots of environmental factors that will influence the epigene. The environment, whether it's a toxic environment or a clean environment, the maternal and paternal diets, and how clean the mother of the child is, of the mother of the child that got cancer. Maternal undernutrition can be very, very important. Malnutrition, what the person themselves is actually eating at the time. So we've already talked about gluten, but sugar and dairy are 2 important things to avoid in cancer. And lifestyle, of course, is quite important. Now, I'll quickly go through this because these are just some of the genes and signaling molecules that influence cancer. So once we increase apoptosis, apoptosis allows the body to kind of get rid of damaged cells. Okay, so if there's some kind of DNA damage, apoptosis will kind of clear those damaged cells. The p53 tumor suppressor gene is probably one of the most important ones. So when your p53 gene is working, it's either going to repair the DNA damage, or if the DNA damage is past the critical point, you will then get apoptosis. And simple supplements that can actually increase this include things like vitamin E. Now, when you're using vitamin E for cancer, it's important not to use a synthetic vitamin E. So vitamin E consists of 4 tocotrienols and 4 tocopherols. Does that make sense? Okay, so you've got to have 8 types of vitamin E in the capsule. If you're giving someone too much vitamin E, it can actually thin their blood. And the simple thing that you'll notice is they'll start getting bruising, but often they might get nosebleeds or get some hematuria or even have some rectal bleeding. So thinning of the blood if you're having too much vitamin E. Genistein, quercetin, conjugated linoleic acid, and optimizing methylation are very important for making this p53 tumor suppressor gene work better. The use of drugs that will work for cancer, and metformin is quite a big one. The BAX gene, again, is another family of genes that will increase apoptosis. And the caspases also increase apoptosis. But the most important one to remember is this p53 tumor suppressor gene. Now, these are the genes that actually increase cancer growth. Hypoxia-inducible factor is a very important one. And it allows cell survival during hypoxia. So in a angiogenesis, so the moment you've got a cancer going somewhere, it has to have a new blood supply, and that's why we talk about angiogenesis. It's also associated with treatment resistance and mortality. Now, the BCL2 gene generally inhibits apoptosis, not always, but 90% of the time. And this particularly occurs in lymphoma and prostate cancer. The next very important one, and I kind of treat this quite a lot, is this MMP. This is a family of enzymes which break down collagen. And this can be inhibited by quercetin, bromelain, which is a digestive enzyme, EGCG, which is an extract from green tea, and curcumin. And you'll find that curcumin comes up in a lot of these different processes. Curcumin has many, many actions for cancer. Heat shock proteins are a family of proteins that are overexpressed in cancer. And again, they encourage spread and metastasis. But they also can cause chemotherapy resistance. And one of the important ones to stop chemotherapy resistance is curcumin, and one that I haven't actually put in there, which also stops chemotherapy resistance. Some of the digestive enzymes can do that. Now, the RAS oncogene, again, is another one that's quite overactive in cancer. And interestingly, it can be suppressed by statins. So particularly simvastatin, there are studies showing how simvastatin can suppress the RAS oncogene. Curcumin does it, again, EGCG from green tea. Omega-3s. Now, when we're talking about omega-3s, it's very important to realize that the omega-3s that come from away from the equator are much more effective than the ones that are extracted from fish around the equator. Okay, so the omega-3s that are away from the equator, from the North Pole, probably not the South, but certainly from the North Pole, those kind of fish are much, much cleaner. And the quality of the omega-3 is much better. Again, vitamin E is important. Again, talking about the 4-tocopherols and 4-tocotrienols. Kyolic is an aged garlic. And it's one of the things, just a little clinical tip, if you're using Kyolic, one of the big things that it also does, it can reverse atherosclerosis, but you've got to be on it for more than 2 years. So it's a very slow-working form of aged garlic, but it certainly reduces, can control atherosclerosis too. Now, mTOR is another signaling molecule that can be overexpressed in cancer, and that tends to be increased by excessive protein. And I'll give you a formula, I think it might be in the next lot of slides, not in this one, how to work out someone's protein requirements. So mTOR can be inhibited again by metformin. Now, I'm not sure if you're familiar with this, but berberine is a very interesting herb. Berberine is something that will reverse insulin resistance. In most people, 60–70% of people, it will actually reverse insulin resistance. And there is a study in America showing how it will reverse type 2 diabetes in up to 40% of people. So berberine, the form we use is berberine hydrochloride, and it's usually 500 milligrams. And you might use it 2 or 3 times a day. So if you use it straight after a meal, because it's got the hydrochloride, it helps you digest protein. Fasting can be very important for reducing mTOR. But again, if someone's got very severe wasting or sarcopenia or cachexia, you're not going to fast them, but you can certainly fast the ones that have got insulin resistance. Ketogenic diet can be useful, and someone's going to talk to you about that. N-acetylcysteine. Now, resveratrol mimics fasting. So resveratrol activates sirtuin genes, and it mimics fasting. So it's like a cheating way of fasting. Again, quercetin, genistein, and astragalus and andrographis are 2 other herbs that will help suppress mTOR. And the other advantage of the last 2, astragalus and andrographis, is they significantly help your immunity, and they can increase natural killer cells. And one of my slides, I've got a list of a lot of things that may increase natural killer cells. And these are cells that you can actually measure to see what your immunity is up to. Nuclear factor kappa B, it's a transcription factor that travels from the cytosol to the mitochondria, to the actual nucleus, to alter gene expression. And it can regulate DNA and inflammation. And again, there are a lot of things that will suppress nuclear factor kappa B, and I've got a slide further on about all the factors that will reduce nuclear factor kappa B. Now, vascular endothelial growth factor, this is increased specifically by copper. So basically, high copper foods are unfortunately in a lot of vegetables. So vegetables are still very important. So when we eat vegetables, when we balance it with grass-fed meat, we're kind of reducing excessive copper. There's also a lot of copper in things like chocolate and carob. There's a lot of zinc, which balances the copper, and zinc comes primarily out of things like pumpkin seeds, cashews, grass-fed meat, and oysters. They're particularly high in zinc. So vascular endothelial growth factor is quite chemotactic for cancer. It's a bit vasodilatory, and it certainly allows cancer growth. So one of the things that I would do in anyone with cancer is I actually measure their serum copper and plasma zinc to see how their copper-zinc ratio is. And if you do a hair test, you can also measure copper and zinc in the hair test, and it gives you an idea of what the ratio is like. Now, don't get too caught up in this slide. I guess the main reason I put this slide up is to show you the importance of the ketogenic diet and calorie restriction. And the way they work is mainly because they're significantly reducing carbohydrates. Okay, they significantly reduce carbohydrates. Insulin is a very big growth factor in cancer, and you're going to see that further along in some of my slides. So when your insulin is very high, you end up with insulin resistance. And that's going to be a big promoter of cancer. Are you okay? Are you still awake after lunch? Okay, and I think this is probably one of the most important slides I'm going to give you today. These are some of the major factors in cancer, and you'll see that we can alter a lot of these factors. So if you look at genes, I said to you that genes can be altered by the epigene, they're influenced by the epigene. So diet and weight, more than 35% influence on cancer. Environmental factors, up to something like 25% for cancer. Lifestyle, 30%, and those are all kind of research figures from various studies there. Now, the cancer personality, so when I see someone for the first time, I always ask them a little bit about their lifestyle before the cancer. And you'll find that somewhere between 8 or 12 years before the cancer, in most of these patients, there's some major significant event occurred that was very stressful, like the death of a family member or divorce or some maybe major change in employment or unemployment. So quite often there'll be some major stressor leading up to the cancer, but quite often these people are rescuers. They kind of give us, so they give to others and they forget about looking after themselves. Now, I imagine this happens here, but certainly in Australia, mothers have to do all the hard work. They do look after the kids. Quite often they work. And I encourage my female patients to have at least 4 hours, a couple of times a week, which is their time, which is not shopping time, which is not work time, which is not husband time, and it's not child time, it's time for themselves. To do something that makes them feel good inside. Exercise is very important. So exercise, 25 to 50% increased survival with exercise. Now, this doesn't have to be hard exercise, it's just getting active. You might be on a stationary cycle, you might go walking, you might do a stretching class. Again, it depends on the person's ability to exercise. But certainly I encourage most of my cancer patients to try and do a little bit of light weights. Now the weights, you don't have to go to a gym and get sweaty. You can actually do very simple weights. For ladies, I just start off with 1 or 2 kilos and just do it. The trick is to do it very, very slowly. So you can do simple biceps exercises, triceps exercises. You can get Velcro with 2-kilogram weights that you can put around your ankle and give them little simple exercises to do extension, flexion, inwards, outwards. And they could start off with doing maybe 10 minutes twice a week and build up to about 20 minutes twice a week. Now, age is the biggest risk factor, not the biggest, but it's one of the biggest risk factors for cancer. And certainly when you're over 60, there's lots of kind of DNA that gets damaged and can provoke cancer. Oxidative damage, someone talked about oxidative damage. So the sun, bad diets, gluten, sugar, stress, insomnia, not eating enough protein, all of these things can cause oxidative damage. Aging itself will increase inflammation. So as we get older, and one of the reasons aging increases inflammation is that once you're past 35 or 40, all your good anabolic hormones start to drop. Once the good hormones start to drop, your risk of inflammation is significantly increased. And cancer is certainly an inflammatory disease also, partly an inflammatory disease. So at the bottom here, I've put things like that will increase inflammation, things like mercury, various toxins, certainly macro and micronutrient depletion. So when I say macronutrient, I mean things like protein, fat, carbohydrates. Micronutrient depletion would be specific vitamins. And I use a particular program that patients fill in a questionnaire, and it gives me an idea of their macro and micronutrient status, and then I can confirm it with special blood tests. Most of us don't eat enough omega-3. We're eating way too much omega-6. So the ratio of 3 to 6 in an ideal world would be 1 to 1, but realistically we even accept 1 to 2 or 1 to 3. But in most societies, we're eating something like 1 to 20. Okay, because we're having way too much omega-6s for omega-3s. Okay, these are some of the environmental influences. I won't go through that in great detail, but obviously herbicides, GMO, Roundup, glyphosate. Xenoestrogens is a big one. So xenoestrogens from various products that people use, shampoos, soaps. Radiation can be very damaging, smoking. So you can read through that list. Now, at the bottom of this, I just want to explain this. Environmental influences, the way to read that slide is bladder cancer, leukemia, bowel cancer are particularly associated with trihalomethanes. Okay? So bladder cancer, leukemia, bowel cancer are associated with trihalomethanes, and those particularly come from chlorinated water, and that's why it's important to have filtered water. Lung cancer has been associated with polyaromatic hydrocarbons. Leukemia has been associated with pesticides, sarcomas with dioxins, and blood cancers with heavy metals. So one of the things that I do when I see people with cancer, I do a lot of testing initially, but once I've got them under control, I actually start looking at various toxic levels. And there's quite a few labs that will measure urine toxins just on a 24-hour urine test, or just a stat first morning urine test to see what their toxin load is like. Now, when I'm treating somebody, I've been taught I've got a guru whose name is Professor Mel, and I was taught when you're treating anyone nutritionally, and this applies to all diseases, the first thing you start with is actually not diet. The first thing we start with is digestion. So you've got to make sure the person's digestion is good. So digestion is number one, diet's number two. Then we look at things like antioxidant level, their EFA balance, their neurotransmitters, their hormones, and there's a whole sequence we go through for every illness, every disease, every chronic disease. Now, these are some of the foods that are cancer. Folate particularly protects against mutations. And the problem with folate, it's very heat susceptible. So even if you just steam some vegetables for a minute or two, you're going to kill the folate in it. So to get folate, you really need some raw things. So when I get people to have vegetables, they're cooked, and I make sure they have some raw salads, so they're getting folate out of the salads. Now, vitamin D is very important. I'm not sure whether people in Thailand are low on vitamin D, but certainly in Australia, even in hot places like Queensland, where there's a lot of sun, a lot of people are vitamin D deficient. Now, you actually get vitamin D out of midday sun. You do not get vitamin D out of early or late sun. It has to be between 11 o'clock till about 2 or 3 o'clock in the afternoon. If you've got a patient who's got a lot of freckles and very high risk of skin cancer, I actually get them to get reflected light. So they can sit in the shade, but wear very few clothes, very short shorts, a little top, and get lots of reflected light. Tea flavonoids are very important, and camphorol is an extract from tea flavonoids. Now, probably the most important vegetable for cancer, does anyone want to guess what the most important vegetable for cancer? Brussels sprouts are important, but not Brussels. Broccoli is getting warm, but you're not there. The most important one is broccolini. Now, broccolini are broccoli sprouts. And a lot more strength than broccoli, particularly for cancer. But all the brassicas are very important. So Brussels sprouts, cabbage, spinach, bok choy, turnips, radish, they're all part of that same brassica family. So I actually get people to have that almost every day. Now, it's not good to have the same food all the time, but if they're rotating through those foods, but make sure they have broccolini at least 2 or 3 times a week, and I get them to just steam it for a minute or 2. Again, there's a lot of research showing, particularly for hormone-responsive cancers like prostate and breast cancer, broccolini is particularly important. And it's a very, very good detoxifier. Now, all spices are good for cancer, but turmeric is probably the most important one. So curcumin, so if you're cooking and you mix it with something like coconut oil or olive oil, you're less likely to kind of oxidize whatever you're cooking. So, I mean, coconut oil and olive oil are very useful. Ginger is very important, and interestingly, in Germany, they've actually isolated these shogeols, and they've made it into a intravenous drip. So I haven't started doing it yet in Australia, but in Germany they do a lot of intravenous ginger. Okay? So it's made by a compounding pharmacist, and that can be used for cancer. Bromelain, again, is a digestive enzyme that comes out particularly out of papaya, but there's also digestive enzymes, from pineapple. There's also digestive enzymes in papaya, pawpaw, lemon, kiwi fruit. Okay, so pineapple is very important, but also papaya, pawpaw, lemon, and kiwi fruit have got quite a lot of digestive enzymes. And when you're using it for cancer, these digestive enzymes have to be used on an empty stomach. So normally we use digestive enzymes with food to absorb the food, but here we're using it on an empty stomach because we want the enzymes to get absorbed, get into the bloodstream. They attack the surface of the cancer wall, so different nutrients can get in. Now, eggs phosphatidylcholine, but when I test people and do allergy tests on them, eggs are the commonest thing that I see. So if my patients can afford to do allergy testing, it's one of the early things I do with people with cancer is do an IgG allergy test to see what they're allergic to. Superfoods, wheatgrass is very important. Coconut oil is very important. Coconut oil certainly helps with immunity. Olive oil, again, I mentioned it in the previous slide. Garlic is very important. So there's lots of ingredients in garlic that fight cancer, particularly the allicin, S-allylcysteine, and selenium. They also increase natural killer cells. There are multiple mechanisms by which garlic works. Ginger is another very important one. So again, it inhibits tumor growth. It's anti-inflammatory. There's a lot of mechanisms there. And this particular clinic in Germany, Dr. Jürgen Arnhold, has been to Sydney 3 or 4 times and given a lot of lectures in using different intravenous ingredients for cancer, which I'll be talking about in the last lecture. Germanium can be useful, and you can get teas and herbs made of germanium, and so is spirulina. Spirulina is one of the ones you've got to be a little careful. You certainly want to make sure your spirulina is from a very clean source, because spirulina can be a little bit toxic if it's not clean. That particular brand where they've done some studies with microhydrin plus, and it's got all those ingredients. Certainly spirulina has been used by NASA astronauts as a detoxifier for quite a while. Now, these are the things we've got to avoid in cancer. Obviously, sugar is the most important one. So if you have a couple of teaspoons of sugar, your white cells will stop working for the next 5 to 6 hours. Okay? Now, our bodies are designed to handle 3 teaspoons of sugar a day. Okay? 3 teaspoons of sugar. Now, if you went to the dessert counter today, you would have got 3 teaspoons out of probably 2 bits of the ice cream. Okay, so sugar is a very big no-no, and I think it's one of the hardest things people have to try and reduce sugar. Trans fats are very important. The saturated fats are a bit controversial, but certainly we know that trans fats are particularly bad. Any kind of processed foods, or any kind of processed meat or processed cheese, aspartame, we know gluten's pretty bad, chlorine, fluoride. I won't go into mycotoxins because that's a whole different lecture. There's a big vogue at the moment to talk about mold toxicity and the effects that mycotoxins have on our body. Smoking itself silences tumor suppressor genes and increases cancer risk. Now, if you're going to be realistic, there are some people who will not stop smoking. And there is something nutritionally you can do for them. So put those people on regular high doses of liposomal vitamin C, so 1,000 or 2,000 milligrams twice a day, and put them on some NAC, N-acetylcysteine. So if they're going to continue smoking, at least the vitamin C and NAC will help them, because the NAC makes glutathione, which is a very important intracellular antioxidant. Okay, so if they're smokers, vitamin C and NAC. I mean, you're not saying that they should smoke, but if they can't stop, that's an option. Factor kappa B already. I just want to show you that list at the bottom here. I'm not going to read through the list. So what most people do is they pick out 2 or 3 ingredients from there. So curcumin is an easy one. If you're going to use green tea, it has to be used as green tea extract. Just drinking green tea is probably not enough. If you want to use green tea to increase nuclear factor kappa B, you've got to get EG-CG tablets. Resveratrol can be very important, so you can go through that list. So most people will pick maybe 2 or 3 things. A very important one is melatonin, and in my next few lectures, I'm going to talk a lot about the effects of melatonin in cancer. Now, this is probably one of the most important risk factors in cancer, is high insulin. Now, does everyone here have access to easy blood testing? Do you all do blood testing a lot or not? Or is it too expensive for your patients? Yes, no, maybe? How many people test insulin levels regularly? Can I have my volunteer very quickly? There was a man who volunteered for me, one of the Filipinos. Quick, quick, quick. H.E.A.T. This is a volunteer when you don't really want to volunteer. Now, I just want to show you, this is probably the most important thing for diagnosing insulin resistance if you're not doing testing, okay? Now, to measure the waist, we're going to do a waist hip circumference. Can I just take this off? So you feel the upper level of the ribs and the iliac crest, and you go halfway, okay? Lower level of the ribs, iliac crest, you go halfway, and this little machine, or this little device, very simple to use once you've got it right.
To breathe in.
You don't have to breathe in too long. Up 80, 85, 86. The hip is just the widest area. And here we're getting up to about 100. So 86 divided by 100. So for a man, we want that ratio to be less than 0.9. And for a woman, we want it to be less than 0.8. So we're looking at the lower level of the ribs, superior iliac crest, going halfway, and that's the waist. Okay? So we want it to be, thank you very much. So we want it to be less than 0.8 for ladies and less than 0.9 for men. But unfortunately for Asians, and I'm Asian too, those numbers probably need to be slightly lower. Okay, so men have to be very careful with their visceral diameter. So insulin increases tyrosine kinase, which is a very important cancer enzyme for increasing cancer risk. Now, not everyone with insulin resistance will become diabetic, but most people do end up being diabetic. So if someone's got insulin, what's the normal insulin level? Someone want to give me a number quickly? Are you metric here, or what's your normal range for insulin here? Anyone? Certainly in Australia, our range goes from 0 to 20, but I want my insulin level at 5. So there's American guy called Bredesen, B-R-E-D-E-S-E-N, Bredesen, who's done a lot of stuff on Alzheimer's, and he's saying the ideal insulin level is really 5 or slightly below that, but you certainly don't want to be over 5. So whatever your lab range is, you want to kind of be in the lower end of the range. You don't want to be too high. Insulin is certainly very proliferative. Is metabolic syndrome, insulin resistance, the ultimate carcinogen? And these are some of the things that will provoke insulin resistance, particularly genes. So if there's diabetes 2 in the family, any kind of severe emotional or physical stress, and a high carbohydrate diet. So those are the things that are going to provoke insulin resistance. Now, be a little careful with high-dose B1 and B2. This is something I've only learned recently, but supplemental doses of B1 and B2 at this point of time are contraindicated if someone has got an active cancer. The B1 and B2 you get out of your food is quite safe, because quite often you're taking supplemental B1 and B2, you're using doses of around 50, 60 milligrams of B1 and B2, and that's actually considered quite high. However, there was an American study in male doctors that showed that using a multivitamin reduced cancer by 8% and reduced recurrence by 27%. But I looked at the study, and they're using something called Centrum Silver, and the doses of B1 and B2 were only 1 milligram. So it was a very, very small dose of B1 and B2, whereas most of the things we use are much, much higher. I'll just go through this very briefly about liver detox. The main things that I use, it might sound a bit unpalatable, but most of my patients with advanced cancer are going to be doing coffee enemas. Now, it's not as gross as it sounds. Once the person's opened their bowels, they go and lie in the bathroom on a towel. They've already made coffee, they've got it in a little container, and they run it through a little tube into their bottom and try and hold it for as long as they can. They might start off with 50 or 100 mils of coffee, and eventually they can increase that up to about 200, 300 mils. If the cancer is very active, I've had one lady who's used up to 4 coffee enemas a day, but most people will do 1 a day or 2 or 3 a week. There's lots of YouTube videos showing how to do that. And you can read through the rest. The other one I use a lot is the infrared sauna. In some of my other slides, I've referred to the infrared sauna as a poor man's hypothermia. So it kind of raises your body temperature from 37. It only goes up to about 37.5, but it has such a big effect on detoxing, a very good effect on cancer. Now, these are some of the things that increase your natural killer cells. Now, the natural killer cells can be measured in a blood test. In Australia, I'm only allowed to do that 3 or 4 times a year. One level is probably one test is not enough. You need to really have a series of tests. And what we're asking for is natural killer cells on the CD57. Natural killer cells, CD, which stands for cluster differentiation, 57. So most patients will pick, again, 3 or 4 of these things and use it for a few months. And I'm allowed to do this test every 4 months. So I can do a test every 3 or 4 months and make sure it's increasing. Now, when it hasn't, I've sent my patients to a Chinese herbalist who won't tell me what he uses. But in some patients, it's increased natural killer cells quite significantly. They've only given me 10 minutes, so I'm going to have to go a little bit faster. So CDCs are circulating tumor cancer cells. So except for brain cancer, all other cancers, once someone's actually got an active cancer, CDCs are going to be circulating in their blood. You can do a blood test, grow those circulating tumor cells, and test them against different chemotherapies, and there's a very big natural panel. And then you can decide which is the best treatment. So this guy came to Sydney. He's still got a clinic in Switzerland, Dr. Ben Pfeiffer. I think he was a urologist who treats a lot of cancer. And in 2009, he showed that the moment someone had a biopsy, that significantly increased the risk of spread of their cancer. So if one of my patients is going to have a biopsy, then what I use before the biopsy is this thing called BioBran, very useful. And the second one is modified citrus pectin. So I put them on BioBran, which they can buy on the internet, and modified citrus pectin. So both of these things tend to kind of wall off the cancer to some extent. BioBran has many beneficial effects in cancer, and the modified citrus pectin certainly walls off the cancer, a bit like vitamin C, and reduces the risk of spread. We don't know how long to do this for, but I certainly start them a week or two before the biopsy, and I continue it for at least 6 weeks. And if the patient can afford it, in practice, I get them to do it for at least 3 months. Okay, so before a breast biopsy or a prostate biopsy or any kind of biopsy. Be a little careful with intravenous. I use a lot of intravenous vitamin C, but what I'll put down there is if someone's having a general anesthetic and being put to sleep for any reason, they must stop oral and IV vitamin C for 24 hours before the operation, because vitamin C can interfere with general anesthetics. I don't want to get too controversial, but mammograms, while they pick up cancers, they probably pick up a lot of cancers that would have not caused problems in the first place. What I do in practice, I still use mammograms, but I only use them every third time. So I might do a mammogram, a thermogram, and then do an MRI. This is really not an official recommendation. This is what I do in practice. Okay, moving on. Okay, so these are the things that are going to increase your risk of metastasis, particularly stress. We've talked about insulin resistance. Now, one of the ways to measure whether your blood's thick on it or not is to measure fibrinogen. Okay, fibrinogen. And if the fibrinogen is in the higher range of normal, for my patients, I want them in the middle range of normal. So even if it's above the normal range or in the high end of the normal range, I would put them on things like omega-3s, curcumin. Magnesium will reduce a high fibrinogen. We've talked about all the factors that affect nuclear factor kappa B, heavy metals, radiation. Now, in terms of painkillers, one of the big advantages, if someone's got, a lot of the palliative doctors will use something like morphine or morphine derivatives. And these certainly reduce nuclear factor and reduce natural killer cells. So be a little careful with morphine. If you have to use a narcotic, use tramadol. So tramadol does not reduce the immunity, but morphine and its relatives will reduce immunity. So morphine and codeine are not good to use for a prolonged time. If you use it for a few days, it's fine, but not long term. Okay, these are a few slides on prevention. Lifestyle and stress is very important. Avoiding high carbohydrates, staying away from gluten and sugar. So even for people who, if there's a family history or if they've got insulin resistance, these are the things you can do, is take them off the carbohydrates, gluten, try and limit their sugar. Any kind of processed food, which I've called Franken foods, because they're really not real foods. Now, to measure people's electrolytes, in Australia, I can do a test called a 24-hour urine test. So just like we collect 24-hour urine tests for sodium for hypertension, you can measure potassium, magnesium, calcium, zinc, cortisol, and iodine. And it gives you a very good idea of what people's nutritional status is like. Obviously, avoid smoking. Don't have too much alcohol. I think the benefits of alcohol are grossly exaggerated. There is no benefit in drinking red wine. Okay, people keep saying, when you get red wine, you get resveratrol. But I can tell you one resveratrol is like about 20 bottles of red wine. So you don't get enough resveratrol from red wine to be good. Sleep is very important for preventing cancer, so you really want to make sure you go to sleep well before midnight. And for women, you want to get at least 8.5 hours, and for men, 7.5 hours is minimum. Now, people talk a lot about fasting. So the kind of patients I see are often very skinny, they're very wasted, and I certainly do not want them to fast. If they came in with severe insulin resistance and had a very big stomach, very high waist-hip ratio, then I might fast them 2 or 3 mornings a week. But fasting is certainly not a good thing when they're already losing muscle, because muscle is very, very important for fighting cancer. We talked about spices, we talked about raw foods. Now, fiber is another very important thing for cancer, but not just bowel cancer, but all cancers, because fiber is a really good detoxifier. And the main one that I use is, of course, eating a lot of vegetables and using psyllium. So when I do my 24-hour urine test, if someone's having a lot of vegetables, their potassium is going to be in the high range of normal. In fact, it might even be above the normal range. So the more vegetables you eat, the higher your potassium is going to be. I've talked about detoxification already. We've talked about waist-hip ratios, less than 0.8 and less than 0.9. Exercise is very important for preventing cancer, particularly if you're doing resistance training. So it's good to do some aerobics exercise, but the main thing as we get older is trying to build muscle. And you can only do that with resistance exercise. So once you go swimming or jogging or cycling, you break down muscle. Most exercise is catabolic. The only exercise that builds muscle is weights and Pilates, where you're using the reformer and doing a lot of stretching with the bands. That will build some muscle. Antioxidants are very important, so I encourage people to have things like green tea, but I also use an all-around antioxidant that's got vitamin A, C, E, selenium, maybe some resveratrol in it. And I get people to use some kind of multi-mineral. Now, if money is an issue, they don't have to do these things every day, but you could put them on an antioxidant 2 or 3 times a week. And probably the most important antioxidant is oral vitamin C. Now, vitamin D is not just a vitamin, it modulates genes. It's actually a pro-hormone. So it's very important, whatever your lab range is for vitamin D, that particularly for cancer, you want to be in the top end of the range. Now, in Australia, our vitamin D goes from 50 to 140, so I'm generally keeping my patients around 120. I certainly don't want them going above the normal range, but I want them on the high end of the range. Interestingly, if people have got mercury amalgams, their risk of cancer and dementia is significantly increased, but even if they've got any root canals. So root canals are a hidden source of inflammation. So if anyone's got cancer, root canals must be removed. But if they've got active cancer, I actually don't remove their mercury. But if I'm trying to prevent cancer, I would make sure that I take mercury out and replace it with a porcelain filling. But the mercury must be removed by a holistic dentist, where they use something called a rubber dam to make sure that the mercury doesn't leach straight into your brain. We've talked about cancer being high in people over 60. Okay, so if we're trying to prevent cancer, diet, digestion, detoxification, and treating insulin resistance are probably the most important things. Digestive enzymes away from food can be useful. I use multis, so I use something that's got vitamin A, C, E, and selenium. I probably wouldn't use much else except maybe a bit of Q10, even if they use it a few times a week to prevent cancer. I would use curcumin, so a lot of the supplements, I might use them for a month, so I might use curcumin for a month, then switch them to green tea for a month, and then come back again. Chronic stress is very important, so I encourage people to do things like meditation, yoga, some kind of breathing exercises so they can relax. So these are the patients that, in practice, I've been treating cancer for about 25 years. I find my cancer patients have no boundaries. They're kind of giving to the point where they have no kind of emotional energy for themselves. Almost everyone, I think I've had one person in the last year who did not have an insulin problem. Just about everyone, when I do a glucose tolerance test with sugar and insulin, the test is abnormal. Often they've had some major emotional stress anywhere between 7 to 12 years before the cancer. Toxicity is very common. Sleep hygiene, even if you've got to make sure they're sleeping well. So it's got to be a deep sleep. They've got to go to sleep before midnight. You don't want them, if someone wakes up through the night saying, I've got to pass urine, the reason they're waking up is not because they have to pass urine, it's because their sleep is not deep enough. Okay, so they're not waking up because it's their bladder, they're waking up because their sleep is not deep enough. Make sure they're getting enough protein and fiber in terms of macronutrients, and make sure their micronutrients are okay. Often people have slightly low thyroid function, so their TSH might be slightly above 2, And so I always check their T4, T3, and their reverse T3. And I generally check their thyroid antibodies. Iodine deficiency is very common, and anyone with inflammation is going to have high copper and low zinc. And I've got 10 seconds. That's it. Just finished.